Sure. There you go.
Which one has the vodka in it?
This is Elizabeth Wettlaufer, a Canadian serial killer, but not in the way you might expect. Between 2007 and 2016, she murdered 8 people, 8 that we know of, and she wasn't caught until she willingly confessed to the police. She was an angel of death type serial killer, working inside a nursing home, targeting the elderly entrusted to her care.
We as the victims are not weak. We need care. And that doesn't mean we don't matter anymore.
I thought this was something that God or whoever wanted me to do it.
These were not people asking her to put them out of their misery. She knew the difference between right and wrong.
And then the laughter afterwards, which was really, it was like a tackling from the pit of hell, if that makes sense.
She killed because she said she heard a voice telling her to kill. A voice, she claimed, came from the pits of hell.
I'm sorry, I'm probably gonna pass gas for this joy.
That's fine. Don't worry about it.
My marriage fell apart in February 2007, and I met a woman online, and she decided to move to be with me.
Okay.
So I ended up quitting the job I was at and going to Crescent Care to make a little bit more money because I was the only bread earner.
Mm-hmm.
So I started working at Crescent Care, I believe it was June 2007.
Okay.
It was after she started working at Crescent Care that her life took a dark turn, spiraling from addiction into murder.
What was your addiction?
Hydromorph.
Okay. All right.
Hydromorph.
Okay. And what, like, how much were you using? And
I was a binge user, so I would use what I could get a hold of
okay.
by stealing it from the patient.
Okay. All right. And how would that work? Like, would it just be in their allotted medications, or would you have access to a card to feed your addiction?
There's some there are a lot of medications. Some of them had confusion, so they couldn't tell the difference between what pills you were giving them, so I'd give them a laxative instead of their Hydromorph. I always was putting this pressure on myself to be a really good nurse and to do everything perfectly.
Mm-hmm.
And every once in a while, when I could get a hold of a Hydromorph or two and take it, then that pressure was gone.
Right.
She set out to care for others, to be a good nurse, but the devil inside her was louder than her conscience.
When my ex and I broke up in 2007, I was already taking the medication for my borderline personality disorder. And I was so angry. And it was like a voice said inside me, I'll use you, don't worry about it. And the different times that I have caused people's deaths or caused them discomfort through the influence, I believe it was the influence of that voice or whatever it was. It wasn't a voice in my head, it was a voice in here. And when I would do it afterwards, I would hear like a laughter in my chest. Part of me had started to believe that it was the devil, and part of me thought it might be God with a purpose through my life.
Shockingly, she admitted she had told multiple people about what she was doing, and despite that, no one ever reported her.
I told 3 people what was going on. My friend from AA, and my friend, I told them what was going on. They said, yes, go and get help. And my friend drove me to the train station.
And when you say you told them what was going on, did you get into details of why you were going to seek help? Or?
I told them that I had been killing people using an insulin overdose. And they all said, yes, you better go get help. So off I went.
Okay. As far as you know, have these people reached out to any of the police agencies where they may reside to notify that you told them this? Or
no.
Did you tell them in kind of confidence?
I told them with confidence, and they said they promised me they wouldn't tell anyone.
Okay.
But basically the impliance was if I didn't get help,
right,
then they'd be on the phone the next day. I had a pastor that I told, and he prayed over me and told me I'd be fine. And that was God's grace. And then...
When was that?
That was Halloween 2013.
So, Mr. Silcox,
Yeah,
okay, September of 2007,
yeah. He's
okay.
the first one that died as a result of what it did.
Tell me about your knowledge of James and your daily interactions during a shift with him.
I didn't see him every time. He wasn't always my patient. I just knew from what people had said that he would grab the nurse's breasts and buttocks, and he did touch me inappropriately once.
And where was that?
On
your
my
body?
breast.
On your breast, okay. And were you alone in the room at that point?
Yeah.
Okay. The diagnosis of his health at the time you were caring for him, do you remember?
He was post-hip surgery and he had dementia.
Do you remember how old he was approximately?
No, I don't. I didn't see him say 80s.
In his 80s?
Yeah.
Okay. And, sorry, he was not a diabetic?
Not a diabetic.
And, sorry, you said he had dementia?
Yeah.
Okay, which you've also noted here as well, right?
Yeah.
Okay. So tell me about the night, was this the first person that you did this to?
That I tried. Well, there were other people that I'd done it to who didn't die
Prior to James?
prior to James.
Okay, and are they documented on here?
He's the first one who died.
Right.
Back here,
But there's some other,
people who didn't die.
was this your first attempt at overdosing these people on insulin?
Yes, because all I was.
Just quick over.
And I didn't really want her to die. I don't know, I was just angry and had this sense inside me that she might be a person that God wanted back with him.
And is that feeling you're referring to that you had in your stomach
Yeah.
at times?
Yeah, but yeah, I just had a sense after my marriage broke up that God was going to use me for something. And then after a while, I started to really wonder after some of the murders if it was God or if it was the devil fooling me.
Did you feel like you were doing the right thing for these people?
No. No. I felt like I was doing what I was supposed to do, but it wasn't what was right for them.
So James, then, it was in the evening that this one took place, right?
Yeah.
It says here at about 9:30.
Yeah.
Run me through.
About
portion of
9:30, I gave him a dose of 50 milligrams of insulin, not diabetic. So I went into it. I used a borrowed insulin pen, borrowed insulin, and gave him an insulin shot. And at 3:30, the PSW, well, throughout the night he was yelling out, "I love you," and "I'm sorry," and not to me, but just you could hear him calling out in his room, and that's what he was calling out. And then at 3:30, the PSWs came to me and said that he was gone. So I did what we're supposed to do. I went and listened to his heart and chest, called the doctor, called the family because that's what they wanted. Family came in and sat with him for a while. Doctor came in and said that his cause of death was from an embolism due to his post-hip. He'd had a hip surgery.
Okay.
Doctor ruled it embolism due to post-hip surgery.
Okay. Who do you think he was talking to when he was yelling out, "I love you"?
I thought it might be his family.
Okay.
I really did. When they came in and talked to me, they wanted to know if he'd said anything.
Right.
So I told them, and I was so ashamed.
Yeah.
So ashamed. Yeah.
When you were speaking with his family.
Yeah.
And is that the family that kind of commended you for the work that you had done? And
Yes, and
spoke to
I've
you how
been
much they
there for
appreciated
him,
things?
and yes,
How'd that make you feel?
awful. Absolutely awful.
How did you deal with it?
I just went home, went to bed. You know, I felt awful. Maybe I fought with my girlfriend. Did some exercising, you know.
Yeah.
Did some games on the computer and just tried to forget about it.
So tell me a little bit about Maurice. This says that this occurred in September or October of 2007. And this was at Crescent Care?
Yep.
Okay, tell me a little bit about your interaction with Maurice.
He was another one who liked to grab breasts and asses. One afternoon I was working with him and he did grab me. And again, I got that feeling inside that this is his time to go. So I gave him an overdose of insulin after supper. And I believe he died the next day.
And what was his reaction to receiving the insulin?
Again, it was just kind of like, oh, okay. I just said, the doctor wants you to have a vitamin shot. That's what I usually say.
And was he able to communicate? Was he verbal?
He
With
was verbal.
Could converse?
Not totally, but he could say something, yeah.
Okay. All right. And did he question his vitamin shot at all?
No.
And he passed away the next day?
Yeah.
Did you ever have any concerns that he didn't pass away while you were working and that, suspicion may arise?
No, I didn't. Well, yes, I did a little bit. I always wondered if they'd find the site where I gave the shot and something, there'd be an investigation. I always wondered that.
Right.
But other than that, no.
And even though it passed through your mind, did you just continued on about your duties?
Yeah.
Okay. And do you remember what part of the body he would have been injected in?
Maybe the leg. Because at that point he didn't have a lot of body fat, so
Maurice didn't?
he didn't know. And when you get a subcutaneous injection, it goes in to the body fat, so.
Okay. And you documented that he was a cancer patient?
Yes.
Okay. Do you remember what type of cancer he had?
I think it was prostate.
Prostate?
Prostate, yeah.
Okay. And what did the outcome hold for his future as far as the cancer in his body?
He was back.
How old do you think Maurice was?
75, 76.
The next person on your list is Helen Matheson.
Yeah.
Okay. So you go from September or October to 07.
Yeah.
And then Helen was 2011.
Yeah.
What happened between those years?
I think you'll see that
Was there some
attempts.
Okay. 08, 09?
Yeah.
Okay. Okay. And we'll get to those.
Yeah.
Okay.
Helen, I don't remember a lot about. She was very quiet, very determined. Just seemed to be waiting to die.
Mm-hmm.
Again, I had that feeling that, this is the one.
Mm-hmm.
And I made a bit of a fuss about her that night because she was very lucid.
Mm-hmm.
And we talked about how much she liked blueberry pie and ice cream.
Okay.
So on my break, I went to Walmart. I got a small blueberry pie and some ice cream and brought it to her, and she ate 3 or 4 bites.
Nice.
And then that night I overdosed her. Because, like I said, I had that feeling that it was her time to go, and
What do you mean by that? Do you think she was towards the end of her life at that
I
point?
know that she was the person to go to.
And that was in your mind, in your stomach? Where was that feeling?
In my chest
In your
area.
chest.
After I did it, I got that laughter.
When would you feel that laughter? Would you feel it right after you injected it, or once the person passed away?
Both.
Yeah.
Both.
You don't say a lot of negative things about Helen here. Did you get along with her okay? Did she ever do anything to harm you, or?
No, she was very quiet. It was just, I got that feeling that she's next, it's her time to go.
And her health at that point, what was her diagnosis?
She was, I couldn't tell you her diagnosis, just that she didn't get out of bed a lot, and she had to be fed her food and fed her pills. So she was near her end of life.
How old do you think Helen was when this happened?
I'd say about 85 or 86.
Do you remember if she had a reaction at all?
A reaction?
Did you know if she confronted you in what you were doing at all? Was she able to?
She might have said, ow.
Was she used to getting insulin or needles?
I don't know if she was.
Alright. But she wasn't combative or she didn't confront you and ask you what you were doing?
No.
Okay. Alright. And you said once you gave them their insulin,
I tried to stay away from it. Sometimes I was very interested to see what was happening. I would just try to stay away from it.
Okay. Would you ever go back into their rooms while they were still alive to see kind of how they were progressing through the?
If they were my charge, yes, I had to.
Okay. Even though you had attempted to take their lives.
Yeah.
Okay. And you would what kind of symptoms would they show? Is it different for everyone, or?
Well, usually they'd get very diaphoretic, red, They could lose consciousness, they'd shake. Some people, one person had a seizure. I think it was just one person. 2 people stroked right out.
Right after receiving the...
Not right after, but they stroked out.
Overtime.
Actually 3 people, because they believe James stroked out as well, so.
Mr. Stokos.
Mr. Stokos, yeah.
Okay. November 2011.
Mm-hmm.
Mary Zerwinski, is that?
Yeah.
How do you recall her last name being pronounced?
Yeah.
And this was at Crescent Care?
Yeah.
Okay, and you said that she wasn't a diabetic, but she had dementia?
That's right.
Okay.
But she could talk and communicate a lot.
Mary could?
Yeah, she was feisty.
Was she?
Yeah. She didn't hurt the nurses or anything. She's just very outspoken and feisty, and one night she said, I'm gonna die tonight.
Mary said that?
Yeah. And I said, oh. And she said, yeah, why don't you get me into the deathbed so I can die? And I said, are you sure? And she said, yeah, put me to bed, I'm gonna die. So I said, okay, and I went to the other nurse that was working with me, and she said, oh, okay, well, let's put her in the side of care room if that's what you want. So we did, and then I thought, well, she must be the next one.
Mm-hmm.
I had a feeling inside of me she must be the next one. Because she was saying she was going to die, but there's no signs she was going to die. So I gave her an overdose of insulin. And she became palliative and she died. I think it's been a couple of days.
And Mary being, we'll refer to her as your 4th victim.
Yes.
The 4th person that you were successful in these insulin injections. How did your emotions start to feel as it kept continuing?
I kept having a lot of guilt. A lot of guilt. Mary, well, as you'll see, after Mary was Gladys, and after Gladys there was a period of 2 years where I didn't do it. 3 years where I didn't do it.
Mm-hmm. What was going on in your life at that point?
I was trying very, very hard to get close to God, to make sure that this wasn't Him, and to just live my life, read the Bible, go to church, and not do that because I didn't want to do it anymore.
Do you think these people died peacefully? Did they struggle at all?
All the people you've talked about so far died peacefully, in my opinion. And I am sorry. I'm sorry for what the families went through at the time, and I'm extremely sorry for what they're going to go through. It's awful.
If you could say something to them, what would you say to them?
What can you say to them that would matter? I'm sorry isn't enough. I should have gotten help sooner. I took something from you that was precious and was taken too soon. I honestly believed at the time that God wanted me to do it, but I know now that's not true. And if I could take it back, if I could get help sooner, I would have. And I'm sorry.
I admire you for everything, whether it took 1 year, 2 years, 10 years, whatever it took for you to finally get help. That's a big step.
Oh, thank you.
Right? I mean, you could have been in this situation and taken this to your grave.
Yeah.
And who would have known? Right?
That's what I was told to do by a lawyer.
What's that?
Take it to my grave and not tell anybody.
So Gladys, so let's take this to November of 2011 at Crescent Care. It says here Gladys was a type 2 diabetic and had dementia.
Severe dementia.
Did she? Yeah. How old do you think Gladys was?
92.
92? Okay. Tell me a little bit about Gladys. What was she like when you cared for her?
Well, when I first started caring for her, she was walking and talking, and she had quite the spirit. She once punched a man.
Oh.
Because she overheard the nurses telling one of the gentlemen, no, you can't push your wife around, you have to come with us. And she turned around and she said, you can't treat a woman like that. Boom!
And hit the man.
and hit the man. So then we're all in a state of trying to keep them from fighting with each other and trying to keep them from hurting us.
Right.
Yeah, she was very spunky, but she went downhill fast.
Did she?
Eventually, she had dementia, didn't take her pills well, didn't eat well, very stubborn woman. And as always, one evening I just got that red surging feeling that she was going to be the one. And gave her insulin overdose.
Did you ever get that feeling outside of work?
No, never.
No. Did you ever get that feeling going to work, knowing that something was going to happen that shift?
No, it always happened at work.
So, if I were to use the phrase spur of the moment, would it be something that you would just have that feeling come on, or?
Yeah, I guess you
Would
could
it
say
build
it
up?
was for the moment, but it usually start happening, focused on one patient, and then I would feel that red surging, which is what made me think it was God. Which I'm so embarrassed.
What would play through your mind on your days where you inject, so Gladys, for instance, you inject her, you work nights, it says here, so
Yeah.
11 till 7. You did this at 5 o'clock. You go home and carry it on about, if you have 1, 2, 3 days off, whatever
Yeah.
the case was. What was going through your mind on those
I-
days off? Were you thinking, when's Gladys going to die?
I would wonder if she had died. I would wonder, if this would be the time I would get caught. What was I going, every time I walked in after somebody had passed away, I always wondered, is this the day I'm going to get caught?
Mm-hmm. And Gladys, do you think, did she have a reaction when you injected her?
She fought a little bit.
Did she?
Yeah.
What do you mean by that?
Like, she struggled around, so I kind of fought on her leg, but I could see where she couldn't reach me and pinch me.
Okay. Would that be something typical if you were giving her medication? She'd like
Yeah.
to pinch?
Pinch, scratch, feel up her mouth.
Is that common in patients?
Yeah.
Yeah.
And, even the PSWs who had to change her product,
Mm-hmm.
sometimes she'd fight them and scratch them and pinch them and twist their hair and, yeah.
Do you think that played into any part of your actions with Gladys, particularly with Gladys?
I don't know, I think some of it did, the stubbornness and stuff, and, yeah, just kind of, okay, you're the next one to go. But again, there was always that red surging that I identified as God telling me, this is the one. This is how you work for me.
Did you ever try and fight that feeling?
Later on, as you'll see.
Mm-hmm. Okay. But when you got that feeling in your chest and stomach, would you directly go to get the insulin?
Pretty much, as soon as I had time with the rest of my job.
How many patients would you be caring for on one shift?
32.
You'd be responsible for all 32?
Yeah, 32.
So each nurse would have 32?
Yeah, nurse, our registered practical nurse.
Okay. So that's a busy day.
Mm-hmm.
And I know we talked about it earlier, but again, just to revisit that, do you think that's something that played into this?
I think
The
so.
stresses of the job?
I definitely think
Because you
so.
had a lot going on in your life.
Yeah, I definitely think that stress played into it. Maybe made my mind more susceptible to stuff.
Did you ever go to work intoxicated by alcohol or drugs at all?
No.
Did you ever use at work?
Yes.
The Hydroworks?
Yes.
Often?
Probably once or twice a week. Yeah.
Mrs. Helen Young. So this is where you have a bit of a gap again. From
Yeah.
2011 to 2013 with your successful injections. But there wasn't even any attempt.
No. In November 2011, I came home from a cruise of the Caribbean,
Mm-hmm.
and I was feeling guilty. I was feeling damned. I was feeling confused. I was feeling like I just didn't want to do it anymore. I was feeling like if I could somehow connect with God strongly enough that I wouldn't do it anymore. And so I spent a lot of time reading my Bible and praying and deciding I just wasn't going to do it anymore. So I had the odd urge to do it, but I resisted by going to church, reading my Bible, praying, and telling God I didn't believe him that he wanted me to do it anymore.
And Helen was a type 2 diabetic with dementia.
Yeah.
Okay. Tell me a little bit more about Helen.
Helen was miserable. She frequently yelled out, "Help me, nurse." She frequently yelled out she wanted to die. She just was not happy with her life. She would wheel around in her wheelchair saying, "Help me, nurse, help me, nurse, help me, nurse, help me, nurse." And when you went to help her, what do you want help with? Nothing. Get away with me. Go away. Help me, nurse, help me, nurse. Didn't want to eat, didn't want to drink. Very difficult to deal with. Constantly would yell out, or we'd say, "What do you want help with?" "I want to die. Why can't you help me die? I want to die." And one night, it was like something snapped inside, and that red sturge came back, and I thought, okay, you will die. So, I gave her a shot. I came up to her and said, "This is for your pain," and I gave her a shot of long-acting or short-acting, and she started to settle down. And then, later on, we put her into bed, and I gave her more of the, insulin. I think it was long-acting. She had a seizure. She turned red. She, was diaphoretic. The PSWs called me to the bedside. I took all of her vital signs, and I pretended to take her blood sugar. Because I said, "Oh, it's normal. Don't worry about it."
How did you go about that with people beside you?
They're PSWs. Don't let anybody see that part of the...
PSWs?
No, but what I mean by that is PSWs, nurses focus on the meds
Right.
and treatment.
Okay.
PSWs focus on, like, they were busy. They were busy washing her. They were busy changing her. They were busy dealing with the fact that she was having diarrhea. They were not doing the part of the job I was doing.
Right.
So they never would have noticed. "Where's my burger?" So they never would have noticed, me not taking the blood sugar. Because I took her, like I did her pulse, I did everything else, so they wouldn't have noticed that I didn't do that because they were busy with everything else.
So being that it had been a few years then, when you injected Mrs. Young and you were successful in causing her death, how did it make you feel after those few years that these urges and these feelings had come back?
I felt horrible. I felt angry at myself. I felt like I had failed myself. I felt like God had failed me.
Did you continue to practice in the church?
I continued going to church, yeah.
Did you believe in as much as
I did, but I was getting very confused. So it was soon after that I went to the pastor and told him what had happened. And he prayed over me. And because he said that was the last thing he would have thought of me. And his wife was there too. And they prayed over me. And they said to me, "Now this is God's grace. But if you ever do this again, we will have to turn you into the police."
And where would that conversation have taken place? At the church?
In their house, at their kitchen table. And I kept going to their church.
And how detailed did you have the conversation?
Oh, I told him that I was taking people's lives by giving them overdoses.
Did Helen have any family that you recall that would come
Yes,
to church?
she had a niece that loved her very much and was there at least twice a week.
Did you ever converse with her?
Before she died, yeah.
Mm-hmm.
Yeah.
How old was she?
I'm saying in the late 50s, early 60s.
The niece?
The niece, yes.
And Helen or something?
90.
All right. Did you speak to her following Helen's death, her niece?
What?
What was that?
I think it was a day or two after when she was gathering her stuff, and she cried on my shoulder and thanked me for being a good nurse.
And again, the feelings that you had at that point?
Oh, guilt, shame, anger, like I had betrayed her. And not that I was betrayed, but betrayal, that I betrayed her.
And did you display any emotion at that point to her?
I just, gave her a hug back and said I was so sorry. But on that point, I was getting very confused about was this God and was it not.
And when you resumed doing this, did you have any, besides the religious feelings that you were having, did you have any other, personal, feelings in your mind as far as knowing the difference between right and wrong again?
Yes, I knew the difference between right and wrong. But I thought this was something that God or whoever wanted me to do it.
So
I was
when
starting
you
at that point to doubt that it was God.
when you resumed doing it?
Yeah.
Okay. March of 2014, this is Marine Pickering at Crescent Care.
Yeah.
Tell me about Marine.
Mine was a handful. She would attack other patients. She would pull their hair. She would hit them. She would pinch them. Eventually, it was decided that she needed a one-on-one staff. So sometimes they would book an extra PSW to be with her. Sometimes someone would come from the outside to be with her. But when one wasn't available, it was the role of the charge nurse.
Okay.
And that was nuts.
Yeah.
Sorry.
Yeah.
That's just absolutely nuts.
Mm-hmm.
So, she just got harder and harder to look after. And one night when I had to look after her, I got this idea. I thought, you know, I'm starting to get the feeling of that surge again. I thought, no, I don't want her to die. But if I could somehow give her enough of a dose to give her a coma, or something to change her brain waves, maybe make her less, maybe make her less mobile, hard to handle, left-handed, hard to handle.
Right.
So, yeah, I overdosed her.
So, RPAD or RTOR,
Yes.
tell me a little bit about it.
He was mean. He would grab the nurses and PSWs whenever they were trying to do things for him. He would grab them, he would twist their arms, he would punch them. Very difficult to do care for. And one night I just got that surgery and I got that you need to go.
Had he done something that night?
No, not really, just been his normal self. And he fought the first needle. And then the second needle I got in.